Hello, everyone. Thanks for joining today for me talking about substance abuse awareness for first responders. So, my name is Kevin Riddell. I'm a clinical psychologist, and I'm running a series of these workshops for yourselves just in understanding different mental health impacts in different areas. And, of course, the main theme in many of them, which is self care. So, the gist of today's workshop is we're going to be talking a little about substance use awareness impacts and kind of what you can do if some of these are challenges in your life. As always, if there's areas that you would like more information on, or you want to reach out with somebody, a psychologist or anybody through the FAP, you can call the 1-800 number or check out the website for more information as well, because there's tons of information online, as well as counselors that you can connect with if you are struggling with any of these areas. So what we're going to talk about today is just some of the common signs and symptoms of substance abuse, so how it impacts our life, some of the different substances that are out there, some of the common ones in particular that you're going to look at, and then just some skills or kind of areas that you can reach out to if you're looking for some supports, right? So by the end, hopefully you'll be able to recognize kind of what healthy versus unhealthy substance use is to an extent. Not that I want you diagnosing, but just recognizing the impacts, recognizing how much it actually impacts those in your position as first responders, even more so than most others, and then just thinking about kind of substance use on a continuum and resources overall. So first thing we're going to go through is addiction itself. So addiction is a mental health disorder, which means it is legally protected by law. So just like depressions, anxieties, or anything else, if I have an addiction, my employer is obligated to support me and help me through some of those challenges with resources, counseling, so on and so forth, right? When you look at mental health and when you look at kind of addiction, the two of them, there's a lot of comorbidity, meaning essentially there's a lot of overlap between the two. So a lot of people with addiction-based issues may also deal with, most commonly, depression and anxiety, but there is not one that necessarily causes the other, right? So it depends on the individual. Sometimes you might have depression that precedes an addiction. Sometimes it could be addiction that precedes kind of a depression or anxiety or something like that, but they do often go hand in hand. So those reporting poor mental health are often 4 times greater to recognize kind of issues with mental health, especially just in this last year or so as a result of the pandemic. I saw some research earlier on that reinforced like over 75% of Canadians, period, were showing increased signs of stress as a result of the pandemic. And we can actually see that substance use has gone up significantly and addictions has gone up probably twice as much as it has been historically because of that. To me, just reflecting how much mental health and addiction kind of go hand in hand. So with that, let's start with what addiction is. So addiction itself, so my definition of it, I tend to pick on specifically the consequences that it has in my life, right? So on the screen, you'll see a condition that leads to a compulsive engagement with a stimuli despite negative consequences that can lead to physical or psychological dependence. But so the addiction itself is going to have negative impacts to the within our life. There's often this compulsive mindset that is going to have an impact in our life as well. Like it's this need, this I I have to have whatever it is. So drugs or alcohol or other variables that can be out there that I'll pick on in a bit, but there's some sort of kind of this desire that I feel like I cannot resist a lot of the time. So that's kind of the simple way of thinking of addictions. There's lots of different things we can be addicted to. So to me, a simple way of breaking it down, anything that fires on the pleasure principle. Drugs and alcohol are the most common of which that people think about, but it could be gambling, it can be video games, internet, sex, shopping, it can be anything that fires off the pleasure principle. So once we start to create this compulsive behavior that starts to disrupt my ability to perform my life, that's the negative consequences. That's essentially to me where the addiction comes in. It is not to me based on amount of use. To me, it's based on impacts of use. So some people might only use a substance or something like that a couple of times a year, but that doesn't mean that it's not an issue. It depends to me on that impact that it's going to have overall, right? So a continuum of use, and this again, it's not that it's definitive essentially, but no use, somebody doesn't touch a substance whatsoever. Experimental use, somebody tries something. You tried marijuana for the first time. You were a teenager, you tried to drink for the first time. You experimented with a different drug, so a hallucinogen or something like that. Social use, occasional use, is when you start to use it a little bit more regularly, but in groups or different dynamics with people. So I go for a drink with guys after work, or I end up hanging out with some friends and they smoke a joint on occasion type things, right? So this is where that social use comes into play. Now, this is not harmful use. Harmful use is when it is kind of ill-advised to use. So the harmful use would be somebody that ends up kind of, if I'm in a safety sensitive position using marijuana where it is a prohibited substance, that is still harmful use because it's not advised. So even socially, if I'm going out for a few drinks, but I'm drinking or binge drinking, that would be harmful because it's not recommended to be binge drinking, right? So depending on what the contexts are, social use could still be harmful to me. But for most individuals, when they go out, they have a drink or two and doing something social, again, if there's no negative consequence, then to me, it wouldn't be deemed as harmful. Prescribed use, of course, my doctor is giving me something. Now, prescribed, it doesn't mean, again, that it's not an issue. So there's a lot of individuals that I work with that have addictions to opioids simply because they have pain. Their doctor gives them painkillers, and then they end up getting cravings and urges, and they become addicted to those painkillers as well. So just because it's prescribed doesn't make it automatically safe. Sleeping pills and things like this, no different. Like, so we can be addicted to these things even with the doctor prescribing it. So you want to look at that impact that it has and recognize is there a need, intolerance, and other variables that kind of come into play that negatively impact my life. Problematic use, of course, is when it starts to really create negative consequences in my life. So friends, family, social, personal, work, like just different areas of my life start to be impacted because of my use. Now, the problematic, again, does not mean that I am always binge drinking or using every single day. To me, it's based off of kind of the impacts when you consume the substance. So if I have a lot of rig workers, for example, that work out of town on dry camps. So if they work a 14/7 shift, 14 out, 7 in, they say I don't use for 14 days. So that doesn't mean that there's no issues with addictions, because to me, it's not about what happens when you're not using during those 14 days when it's not available. It's about what happens when it's available to you and when you do use it and how much does it impact your life. But it can also be when they're away for 14 days. Are they thinking about it, counting down, still craving it? So I can't wait to get back so I can use again. So like that's still kind of the thought process is still dedicated to a substance in and of itself, right? And then we have dependence and abuse itself. So again, even greater than just problematic, but this is when there starts to be a lot more kind of criteria that are checked off as we're doing the assessments with physiological and psychological and physical kind of components that could be impacting the person. Now, you don't have to meet every single one of the criteria. Depending on how many criteria are met, there's going to be mild, moderate, and severe substance use-based disorders. And these things, you don't just move through them in a continuum either. So it might look like, oh, we would start at no use and then kind of go into experimental and then into social, but it doesn't always work that way. Some people, no use, of course, is not really a factor, but they go straight from experimental, they try it, and then automatically, the first time they use cocaine, they're like, I need more of this. And then they jump straight into almost a dependent and physiological, like I need more and more and more and more and more, because every single person's body responds a little bit different to substances. So just note that we don't always go from one to the next, to the next, to the next in that continuum. In fact, situations can be a big part of it as well. So in your position as first responders, based on certain events, certain kind of dynamics of what's going on within your life, the traumas or the events, the critical incidents that you're exposed to, you might end up consuming at different points in time, and more so kind of based off of the more significant the impact, you might consume more in some of those areas. And then when things are going well, your consumption could actually shift. So it can go up and down on that continuum based on circumstance of what's occurring. I remember a research study that they actually did with military individuals based on substance use, where there was a ton of individuals that overseas, when they were deployed, were actually using a lot of different drugs and alcohol to cope with everything that they were going through, right? And then when they returned back home, they started to follow them to see what would happen. Now, some of them, of course, maintained those addictions because of the components, the genetics, the predispositions, who they are, support networks, and kind of variables come into play. But some of them, as soon as they came home, didn't care for it again whatsoever. So there is no simple rhyme or reason that you move down the path. Some people might be using problematically, but then they get back into a different position where life is good, grand, and they can cut it out and don't touch whatsoever, or they can use socially, right? So it depends on the individual, and that's where comparing and contrasting to others doesn't, to me, mean anything. The reason we start to use as well is not always the reason that we continue to use or move along those continuums. So you might have started to drink because it was just social, and then all of a sudden there's a different reason in the future, stress management, sleep issues, or something else, or something else. You might have started because, you know what, I wanted to drink because it helped me to fall asleep. And then down the road, it ends up adapting. And now I don't use it just for sleep anymore, but I use it as soon as I get home. I start drinking and you keep pounding them back and things like this. So there's constant shifts, and that's where there's so much in awareness and insight into your patterns and behaviors. When we look at substance use, I'd be looking at during my appointments with individuals struggling with any substance itself. Some of the risk factors that we look at. So one, of course, a personal factor is the genetic side. So do I have a family predisposition? Are my parents or extended family, my grandparents or aunts and uncles or other siblings, do they have addictions? Because if they do, there's a greater chance that I could be predisposed to also become an addict in the future. It doesn't mean that I will be, but there's a greater likelihood that I could be, right? High stress. Sadly, a lot of people turn to substance use as a coping mechanism for stress. Sadly, it just tends to create more problems. So this is where that same personal crisis to me and the stress comes into play. Similar again to trauma, similar again to depression, but it's all of these, it's almost coping mechanisms that people end up turning to personally and trying to deal with things, but it's a temporary coping mechanism that actually generates more problems because it doesn't fix anything. It's almost like that Band-Aid approach. So I take a painkiller because my leg is broken, but it doesn't fix my leg, but I keep trying to run on it. That's kind of what alcohol or any other drug does, is you might mask an issue, pretend that things are better, but it doesn't fix or address the actual issue itself. In the workplace, of course, again, there's tons of issues, again, based on the traumatic things that you're going to be exposed to, the critical incidents, and the people that you end up dealing with. But this is where burnout, fatigue, no satisfaction, again, stress is there. Boredom and repetition can be part of it. I don't know if that's going to be as significant variables for yourself because your work is probably going to kind of keep you on your toes a lot of the time, but it can be a factor for some. And then isolation, so not necessarily having that same contact. So for yourselves, especially if this is volunteer rather than just full-time, you might be pretty connected within the work environment, but then when you volunteer, you don't have a lot of free time, so you end up isolating a little bit more to deal with things. You don't reach out, you don't talk to people the same way, just because by volunteering, you don't necessarily have that same flexibility to pop in and do things with other individuals as you would if you desire to, just because you had the free time to do so. So in that first responder mindset, again, this is where that high stress is probably one of the main areas. Sadly, a lot of people turn to substances as that coping mechanism for it, right? Because there's constant exposure to these challenges, things that are coming up, and because of the long hours, the shift work that it can impact, the fatigue that it creates, the poor sleep. So we turn to substance use as a coping mechanism. Have a drink to fall asleep, smoke a joint helps me get to sleep quicker, right? It doesn't result in quality sleep or anything like that. We start turning to it simply because we perceive it to be more effective than not doing anything, or the smoking a joint or having a drink. It can numb or help me relax or whatever it is, rather than finding healthy coping mechanisms in order to deal with these things. So these are all the unhealthy ones. And a great way to kind of break down healthy versus unhealthy coping mechanisms to me is projected to the future. So if I was to continue to use this strategy in the future, 6 months, 6 years, 60 years from now, would it actually better my life? And the vast majority of the time, the answer is no. If I'm drinking or using drugs, if I keep doing this, it's going to make things worse. Whereas if I reach out to my friends or I do some meditation or I go for a walk or go to the gym or burn some energy or whatever it is, these things, if I continue to do those long term, I know that it will be a better impact in my life. So you can kind of break it down, healthy versus unhealthy, just by projecting to the future. The unhealthy might give you this mindset that it's helpful, kind of that immediate gratification, but it tends not to prolong the effects. So thinking about kind of the careers that you're in right now, so just doing first responder based work, firefighters that are full-time tend to have higher levels of alcohol and PTSD, so problematic alcohol use and PTSD, post-traumatic stress disorder, compared to volunteers. Unfortunately, volunteers tend to have higher rates of depression and suicidality and suicidal attempts. So there's different impacts that it has. And to me, this is based off of the exposure and also kind of other supports, the fact that you guys might be able to buffer some of these things out, but you don't always have all the same resources that others would have if they were full-time as well, right? When we reflect just over a simple 1 month time frame, so if we look back 1 month over interviewing a bunch of different firefighters, there was over 50% of individuals, essentially male in particular, reported that they were binge drinking alcohol, often as a coping mechanism to deal with whatever it is that they were doing, right? And almost 10% of them reported driving while intoxicated. Now, this is likely an understatement simply because it's based on a self-report. So the numbers are actually most likely higher than this. There's more likely to be greater than 10% of people that are drinking while under the influence, and there's likely greater than 50% of individuals that are binge drinking as a coping mechanism because they didn't necessarily want to disclose what they were doing in that self-report. But this is much greater than the general population, where you're going to find the rate's going to be much lower. So maybe 10, 20% kind of doing that binge drinking and kind of intoxicated driving, you're probably looking at kind of 2 to 5%. So it is much higher for those in those first responder positions because of the events, because of the traumatic scenarios, the incidents that you deal with. So some of the challenges and why first responders turn to substance use. First, again, it's that heroic mindset. Like, we're supposed to be the heroes. We're supposed to have it all together. I'm supposed to deal with everything. I'm not supposed to fall apart. I'm supposed to be the knight in shining armor. I'm not supposed to be weak. I have to take care of everything. So because of that, there's this negative stigma that if you're having a hard time, you must not be doing well, right? So you can't admit it. You can't talk about it. You can't reach out to anybody because it's this sign that we're doing something inappropriate. Now, again, because the gender in the role tends to stereotypically be more men, this is also where we look at even just societal standards and upbringing components that come into play. So if you think about a young child that's 3 or 4 years old that's running down the street, trips and falls, if that child is a girl, often the parents run, they coddle, they kiss, they bandage everything up, and they kind of move forward. If that child was now a boy, they're typically told, get up, deal with it, and move on, right? Now, this is not universal, of course, but typically men are taught when something happens, deal with it and move on. Women are taught to talk about it, to open up and to experience what those things are. So this is shifting a little bit kind of with the world. So like I said, that's not where the universal comes in, but that mindset is still ingrained in many of us. So especially for a lot of men where we have this fix it mindset, if there's a problem, just fix it. Don't talk about it. Don't vent about it. Don't open up about it. Just do something about it. Sadly, the do something is often, well, I'm going to cope with it by having a drink, by smoking a joint, by using a substance, whatever it is, but it doesn't fix the problem. It just masks it. So because I'm just masking it, I feel like I'm dealing with the problems when really all I'm doing is bottling things up and letting it become more of an issue that will present in the future as well, right? That stigma, it creates this mindset that because I'm supposed to have it all together and fix everything, that I'm not allowed to do or ask for help. So just recognizing for yourself, do you have those same barriers or that same stigma that I don't reach out because I don't want others to perceive me as doing something kind of, or a sense of weakness. So I'll just fix it on my own, right? Some of the indicators that you can identify just for substance use and abuse. So behaviorally, of course, you're going to notice latenesses or absences. So often it's going to be beginning of shift, people show up late, or people leave early at the end of a shift. You're going to notice for a lot of these individuals, it could be Mondays or Fridays, if it's or the first or the last day of the shifts in particular, that they show up late or they end up leaving early so they can go home and drink or do something a little bit quicker if possible, right? Lots of accidents would be occurring, not complying with general policies, procedures, safety kind of aspects, and then be kind of just defensiveness. So snapping, I'm more argumentative and angry because of it, which also comes into that physical. So the moody, erratic, irritable, things like this, I'm more avoidant and isolating from other people. Personality, you might notice kind of a change in how they appear. So they're more disheveled, they don't take care of themselves. So they're kind of more bloodshot eyes. There could be adjustments in weight up or down. There could be just simple physical things that you'll notice with bloodshot eyes, flushed skin. You could notice just kind of sweats and palpitation, or just kind of just shakes in the hands and things like this. But you could notice, you're going to notice just individuals that could be seeing or kind of responding to things, hypervigilant to different things, which is all dependent on different drugs. So the different drug we use, there could be different impacts for those drugs. The most common drugs that you're going to notice are going to be, of course, the legal ones, alcohol being the most highly consumed for the substance of kind of the addiction within the first responder world. But caffeine, which is the most highly consumed addictive substance on the planet, doesn't typically result in negative consequences unless it starts to impact my sleep and other areas because I'm using it too much. But alcohol and marijuana in particular. So marijuana for many people simply because now that they say that it's legal, they use it for everything, but it can also inhibit your reflexes, your motor speed. It can generate more anxiety for certain people. So there's negative consequences that it can have. And then of course, illegal, which could be to me just any substance whatsoever, including the seeking out of prescription drugs, even though it might be legal, but not as prescribed, just using it on your own kind of accord because you were seeking it out to get a certain high or to deal with certain challenges. To me, it doesn't matter what this substance is in the end, there's going to be consequences that we're looking at as a result of that use. It's impeding my performance to carry out my day-to-day life. Right? I'm not going to spend a ton of time on the next two slides here. These next two, we're going to just talk about just some of the effects. You guys can go over these a little bit yourself, just to kind of looking at which substance maybe you've used or even just identifying at some of the others. But of course, just examples of the drug itself, those are kind of pretty stereotypical. But alcohol, I'll go over the most common ones. So alcohol, some of the general effects, drowsiness, of course, the mood swings you're going to notice, impaired judgment, memory, focus, concentration can be disrupted. So motor function is going to be impacted, slurred speech. And this can be either during or after the use of it. So it doesn't have to be either intoxicated at the time. Some of these things could even be withdrawal effects after somebody has consumed a significant amount of alcohol for the most part. Cannabis, so marijuana and hash are the most common of which, but again, you're going to notice drowsiness, kind of appetite changes could be part of those areas. Memory, focus, concentration, again, could be disturbed. You could notice kind of the glossy eyes, the giddiness. So it just changes in those behaviors, but even just certain behaviors and mannerisms could be stunted or impacted because of that. Some of the other ones, like I said, if they're in your life, you can kind of have a look into it in a little bit more detail, but I don't want to go through all of them. Stimulants, so another one of the most common ones that will be used, especially in our area, is cocaine. So if somebody's using cocaine, we're going to typically notice kind of one, if you're going to notice a drastic behavioral change between them might be kind of subdued, and then all of a sudden, moments later, there's this exaggerated sociability, a heightened energy, kind of ready to go, taking off, top of the world, right? So typically they would have just used, if that's the case, you're going to notice dilation in their pupils that are going to shift, and then just impaired psychomotor actions and things like this as well, right? So just depending on what the substance is and kind of the drug of choice for people, there's going to be different effects for each person that you can kind of break down. And that's where you don't have to go through all of these yourself, but just be aware that there are different impacts for every single drug. So it's not always going to be universal. Not to mention that just because some of those may be present doesn't always mean, of course, it's the impact of a substance either. Yeah. So we're going to pick a little bit on alcohol, but as some of these slides that I'm going to go through moving forward, it's going to state alcohol up top, but I'm going to kind of generalize it to all drugs simply because drugs and alcohol, some of the variables are going to be very common. So alcohol is the most common used. Almost 80% of Canadians 15 and above have used alcohol at least once. For most individuals, so for people that have never consumed alcohol, most of those individuals is typically because of religious and spiritual beliefs that they do not tend to consume. But most individuals do not end up getting to a position either where it becomes physically dependent for them, right? The highest risk for individuals and the most prevalence of use tends to be youth, because that's when people start to try it. So between that 18-24 high school, university ages is typically where people tend to use it the most, right? And then it tends to taper down for most as they start to find a balance with it. Now, it doesn't mean that kind of what we use when we're younger is good for us. This could be the experimental, it could be the social, but it could also be problematic. So you end up going to school, you have an exam the next day, but you went out drinking, and then the next day during your exam, you're hungover and you can't perform. Like, that is still problematic use. That's still a negative consequence that's going to happen in my life because it's going to impact my grades, which can impact my future, and so on and so forth. 15% of Canadians are dependent on alcohol. So these are the ones that they have cravings, the urges, the tolerance, the withdrawal, the negative impacts, the inability to quit. And it's not just hey, just snap your fingers and say, I'm just not going to use anymore. If you can just stop using at any given point in your life, odds are it is not a dependence, at least a physiological dependence where you can just say, hey, I'm walking away from it. Addiction is much more complicated. If it was just as simple as just stop using, we wouldn't have counselors and rehabilitation programs and groups and meetings and everything for these individuals because they would just stop using, right? So it's a much more complicated than I'm just not going to use. So when you think of addiction itself, to me, this is where I pick on, like I said, it's the impacts that it has. But that impact, a lot of people end up comparing and contrasting to that social network. So I remember one of my clients where he was coming in where he ended up telling me, so he ended up failing a drug test actually for cocaine. So when he came in, I tend to assess your entire drug and alcohol history because I'm looking for patterns, routines, just different cycles that you can go with because you can shift from one to the next to the next. So when I started asking him about alcohol, he was pretty defensive because he's like, I don't want to talk about alcohol. Alcohol is not the problem. I failed for cocaine. Let's just focus on that. So eventually I get him to humor me. He starts to open up about alcohol. So I go, okay, so I didn't want to talk about alcohol because I used to have a problem with alcohol, but I don't anymore. I'm like, all right, great. Thanks for sharing. So how much did you used to drink? So he told me he used to drink 26 ounces of hard liquor every single day, right? So that was a bottle of hard liquor every day. Currently, I said, so how much are you drinking? He's like, I don't drink like that anymore. I knew that was a problem. Now he only drinks 12 ounces, a Mickey of hard liquor every single day. So to him, he feels like he's beat his addiction. To me, he hasn't done so, not at all, right? Because he's still drinking 12 ounces of hard liquor every single day, which definitely exceeds what would be deemed as healthy, not to mention the fact that it's still having negative consequences in his life, right? So this is where his argument was my friends, his comparison, they still drink 26 ounces of hard liquor every single day. So when he looks at other individuals, his social network is still using more than him. In fact, twice as much as he uses. He's drinking half as much as his friends. Therefore, he perceives it as no longer a problem because socially, he's drinking less than other people. And this is where the issue of comparison comes into play. We start to deny any issues. We start to pretend there's no problems because others have bigger problems than I do, right? And it's not about what others use. I don't care what your friends and your family, your parents, or anybody else's use, kind of, and what the impacts is in their life. I look at, and I want you to do the same, your use. How much is it impacting your life? Is it impacting your relationships, your friends, your family, your work, your sleep, your kind of emotions, your mood? Like, is it having a negative impact? Because if it is, that is problem-based drinking. Doesn't matter if others drink more than you. If you have a low tolerance for alcohol, so you only have one or two drinks, and that results in negative consequences, that can still be addiction-based. Just because you do not tolerate it the same as someone else doesn't mean that you should be drinking two or three drinks, because healthy limits within Canada says two or three drinks per sitting is acceptable for a man, one or two drinks per sitting for a female, up to 15 drinks per sitting for a male, or sorry, up to 15 drinks per week for a male, up to 10, 12 drinks per week for a female, right? Just because you're within that limit doesn't mean that it's healthy. You got to look at how much it impacts your life, right? So that's where a lot of people, they think based on what others are doing, it's not a problem because I don't use as much as anyone else. And then it prevents them from reaching out, getting support, or actually doing anything about it because they just normalize it as no longer an issue because others use more than them, which is why you really want to look at the impact it has on yourself. So when we think about the impacts, so abuse itself, there's going to be a couple of impacts that it's going to have in your life, but it's going to be typically more on the mild end of impacts. Whereas when you look at dependence or actual alcoholism, it's typically going to be more moderate or severe based impacts that it has in your life. Abusers of a substance are typically going to have a little bit more control over it. So it's not the same cravings or urges, but it's still negatively impacting your life. And typically the abuser, it's a recurrent problem. It's not just a one-off. So if I've had a recurrent issue, and the time frame we use in the diagnostics is 12 months. So if I've had any issue with the substance a couple of times within a 12-month time frame, then odds are I've abused that substance. So again, not just alcohol, but drugs, marijuana, cocaine, meth, LSD, MDMA. It doesn't matter what the drug is. If I have used it a couple of times, it's negatively impacted my life, and I've abused that substance, legal or illegal, it doesn't matter, right? Alcoholism dependence is when it starts to become more of a regular based issue, but it doesn't have to be a daily issue. And that's where people, to me, tend to misperceive what addiction is. They look at it as somebody that has to use all day, every day, and they can't get away without using. But that's where my reference of the rig worker comes back into play. It's not a matter of what happens when you're not using. It's a matter of what's going on when you're not using. You still think, crave, urge it. But then when you are using, what is the consequence that comes out of this as well? right? So abuse is a risk factor because it can move down that continuum. Again, it doesn't guarantee it will, but it is a risk factor to become dependent on a substance of any substance, right? So again, not just drugs and alcohol based. Some of the common things about looking at abuse. So again, it's I'm missing out on activities. So I'm going to go fishing with the kids tomorrow, but I wake up in the morning, I'm drunk, I'm hungover, I'm still withdrawing from whatever it is, I can't make it. So because of that, that is a negative impact in my life. So if I have a handful of times when this has occurred in my life, that would be perceived as abusing the substance in a 12-month time frame because I've missed out on multiple family activities or events or work-based activities or events or getting to the job, called into work because I was hungover. If I had called into work twice this year because I was hungover, couldn't do it, that means I was abusing the substance because I know that the next day I'm working, I drank to excess, I can't get the job done. If we end up recognizing there's dangerous consequences as a result of it. So, of course, using and driving, so smoking a joint, using cocaine, having a kind of drinking and then driving, this is all physically dangerous. So if I haven't done that, and even if I'm not caught, it doesn't matter if you're caught. If you end up going out for a few pints, you would blow over, you get in your car, you drive home, and you never got pulled over or your ticket, that is still dangerous driving. You are still abusing the substance, right? So that is still a consequence. And to me, it doesn't matter that you haven't been caught yet. It's the risk that you're taking of your life and anybody else's life on the road that is, of course, the major factor here, right? Drinking, even though it's kind of causing problems to your friends and family. Now, this one is a little bit tougher. So I remember one of my clients, she told me that she drinks a couple of times a year. Her husband, so it was like her birthday and Christmas were the two times that she brought up, but she only has like a glass of wine and her husband did not like it, so it created problems in the relationship. So this to me isn't quite the same as abuse because for him, his parents were alcoholics. He was hyper vigilant to anyone that ever consumed, so he always hated it when she had a drink or two. So to me, his reference point is skewed because of his backstory. So to me, it depends. But if I'm coming home drunk, I can't help with the parenting. I can't help with chores or laundry or housework or things like this. And now I'm creating problems. My spouse is upset. That's completely different, right? Because that to me is more of a tangible scenario where I'm not contributing again to the household. My partner is also upset about it, or my kids or something like that. It's not simply because they just don't like booze, period. And that one sip or one drink would be kind of prohibited. And that's the same sometimes when I deal with the religious dynamics, when I have some families where they do not drink whatsoever, and then a child tried alcohol or they tried it, so it can create problems within a relationship. But later in life, I know that kid doesn't have addiction issues, but they casually use, but they're still not involved or invested in that same religion that they were brought up in when they were youth because they made different choices. So there is some complexity that goes into it in the assessment, but the relationship is another one of those areas that I would look at. And then, of course, using to relax and de-stress. To me, substance use should not be a coping mechanism again, because it's an unhealthy coping mechanism. So if you use alcohol to get to sleep, marijuana to get to sleep, if you use cocaine to keep you alert so that you can do your job, like you shouldn't be using it to deal with things that are going on in life. If you're using it again socially or something like that, to me, that's not a concern as long as we're not above and beyond in consequences after the fact. But I don't want people using it as coping mechanisms. I had a tough day, I really need a beer, right? Because that shows again that there's this need or this craving for a drink in tough times rather than having healthier, more positive coping mechanisms, which I would rather you engage in. A couple other things. So this is where kind of dependence and alcoholism, this is typically where the moderate to severe consequences come into play. So tolerance, I start using more than I used to. So I used to have 2 pints, now I have 4 pints and I have the same impact. So I still feel sober after the four. Then it becomes six, then it becomes eight, then it becomes, again, I can finish off a case of beer or whatever it is, right? So your tolerance starts to increase is a sign that you are drinking to excess because you need more of that substance to get the same impacts. Withdrawal effects. So a simple withdrawal effect, of course, of alcohol is a hangover, but it could also be shakes, heart palpitations, or DTs, to delirium tremens, right? Hallucinations, seizures, vomiting, throwing up, nausea. Like these are all withdrawal effects from alcohol. So often people will have a drink the day after, the hair of the dog, to get rid of those effects, but that doesn't make things better. In fact, you're prolonging the issues, right? Loss of control. I only wanted to go for 1 pint and I ended up with four because I just couldn't stop myself, right? I want to stop, but I can't. So I've attempted on repeated occasions. I've done dry November, I've done dry September, I've done dry January through December, whatever it is. But every time I stop, I always get back into it for some reason, and then I lose that control again. There's another big red flag, right? I give up activities similar to what the previous slide was. So I couldn't go golfing, I couldn't go to the mountains, I couldn't go for a bike ride, I didn't go to the movies, or I just wasn't able to engage in things that I desired to because I was using instead, right? So it takes up a lot of that time, mental, physical, emotional. So again, it's not about just using. If I'm at site or if I'm at work and I'm like, I can't wait for work to be done so I can have a drink, that to me is another one of those red flags, because I don't want you just counting down minutes and hours or whatever it is till the drink, because that shows it's that coping mechanism, which could be the cravings and urges that I'm starting to develop for kind of dealing with the traumatic events. And then continuing to drink, even though I know it's causing problems, right? So my friends, my family, my work, my employer, my shifts, like all of these things that have been present, I'm aware of it and I just keep doing it. My doctor says don't take alcohol because you're taking painkillers, but you do it anyway, right? Don't drink alcohol because you have diabetes and it can spike your blood sugar, but you do it anyway, right? So your blood sugars go all over the place, your cholesterol, like there's different factors and variables, but you just say, I don't care, and you do it anyway, which is generating more negative consequences for you. So that's kind of where you don't have to meet all of these different variables, but I'm looking at patterns. I'm looking at the complexities of the interactions between them. I'm looking at time frames, durations. Has it been within 1 year, 5 year, 10 year, like just different time frames of when they've happened? Do you shift from one substance to the next, right? So all of these, not just alcoholism, but the same thing, tolerance, withdrawal, marijuana, cocaine, meth, MDMA, heroin, like it doesn't matter what the drug is, all of these variables are going to be kind of the same. Taking up time, arguments, conflicts with others, inability to stop, kind of these are the main variables that indicate that there is a problem that is more moderate to severe than, again, just the casual social use of somebody that kind of goes for a drink after work. And I'm not saying after you go for work, you can't go for a drink for whatever it is. It's you're looking at the impact of what happens after work. So if you just had a long shift and you went out with the guys for a drink afterwards, you're not doing it because you needed to drink. You went because you're socializing with the guys and you're kind of debriefing the day, and it was with a drink, but it could have been a lemonade or an iced tea or just a pizza that you did the same thing with. It wasn't the drink that was required. It's just the fact that the drink was present. That's not something of major concern to me. Okay. So if you recognize that you kind of fall into some of those areas and some of those are kind of components of your life that are creating issues, just note that this is something that there is treatment for. So you can reach out to your employer because, again, it is legally protected. So by reaching out to the employer, there is confidentiality variables, and you can ask HR about, okay, so what is breached, what is not breached. But then you can find out what are the resources. Will they help? Will they support? Will they end up providing certain benefits and packages to help you get certain treatments as well? There's the EFAP, so in person right now is not necessarily still going just because of the pandemic. That's likely going to shift at some point, of course, so that we can get people back in person. But there are in-person meetings that you can do through AAs, NAs, smart recovery groups and programs that are still doing some of those as well. There's tons online and over the phone as well. But this is where there are tons of different self-help groups that you can engage in outside of EFAPs as well, right? So AA and NA, more of the common Alcoholics Anonymous and Narcotics Anonymous, two of the most common ones people attend, but Smart Recovery. So if you've ever tried those and you're interested in doing something else, if you've heard of Smart Recovery, or if you haven't, it's another really good program that I find some people who don't feel like they click with AA or NA find that they click a little bit better with Smart Recovery. Some people like both, but it's just finding what works for you, because to me, there's no one path. There's tons of programs, resources, psychologists, counselors, and other therapy that's out there as well. So inpatient and outpatient programming, depending on, again, the severity, the complexity of that addiction. And to me, a lot of people I know, they're hesitant or reluctant. Like, I don't want to do a treatment program, but you want to think big picture. And in the big picture, one of the things that I pick on is kind of this 10-10-10 rule. So 10 minutes, 10 months, 10 years. So I currently have this craving for a drink. 10 minutes from now, you gave into the drink. Well, you might feel a little bit guilty, but you also might feel a little bit of that instant gratification because you got rid of the craving, right? 10 months from now, you're probably using ongoing and it's impacting your work, friends, family, social, personal life. 10 years from now, it's not uncommon to have lost many of those things. don't have that same job, don't have the same family, don't have the connection with the kids, financial challenges, like 10 years from now, we can see a negative impact because of that ongoing kind of substance use. Whereas if we take the other path, 10, 10, 10, but 10 minutes from now, I didn't drink. I did not choose to have that substance. Now I might feel uncomfortable because I really want it. I still have that craving, but I don't give into it. 10 months from now, I'm probably in a better place. I don't have the same urges and cravings that I used to have historically. 10 years from now, friends, family, relationships, work, like there's a lot of variables that tend to improve because I get that sober brain back and my ability to engage back into my life, right? So using that 10, 10, 10 is a big part of it. The addiction programs, the inpatient ones, is one of those ones that you can do that 10, 10, 10 for as well. Because I have a lot of people that they're really hesitant, really reluctant to want to do a treatment program. So like it's so invasive, you end up going to the program, you reside in the program for a period of 4 to 6 weeks plus, depending on, again, the severities of the addiction. Like, I don't have the time, I don't want to do it, I have family at home. But again, think if you took that kind of, you engaged in the program, 10 minutes after you're done the program, 10 months after you're done the program, 10 years after the program, hopefully there's improvement. Or if we avoid it, kind of 10 minutes later, 10 months later, 10 years later, I have a lot of people that continue to struggle with those same issues because they never sought the appropriate support. And that doesn't mean all addicts need treatment programs, inpatient or outpatient. Again, it depends on the variables and the complexities of their life. But just know there are options, and doing it sooner gets you more of your life back if there is a severe issue there than just waiting and trying to do it all by yourself. Okay. If there's someone else in your life that does have addiction, just note, just like when you're working with anyone else in the public, that you cannot make anybody change. So my role as a clinical psychologist, I deal with addictions pretty much every week, if not daily, depending on my caseload. And with those, I cannot make all these people stop. There's numerous clients that I've let them know, like it's some of them, one that pops into my mind for him, he's had a marijuana addiction for years and years and years. I've worked with him off and on for a couple of years, and I've let him know, like, at this point, I cannot provide the intensity of counseling that he needs in a one-on-one appointment because of the severity of his addiction. So I've suggested repeatedly that he needs to get a treatment program to actually deal with this issue head on, right? Now, he reaches out 6 months later, he's still in the problem. 6 months later, still in that problem because he didn't want to do the treatment program. The last time I spoke to him, it was not just him, it was him and his wife. And his wife's like, if he doesn't actually change, I'm leaving him. Like, I can't keep doing this anymore. And to me, it's the same thing. He's got to do something that's more intense, right? So nobody can make him change. I can't make him go to programs. His wife can't make him go to that program. Only he can make that choice. So recognize for yourself when you have someone else in need. You can provide tools, skills, resources. You can do interventions. You can listen. You can disengage from kind of unhealthy factors that come up. So you can not go to events where booze is around. You can let them know that I'm not going to participate if alcohol or you will be drinking. We can stop engaging with these people when those events are present, but you cannot make them stop. But in the end, you can control what you do. But you want to be supportive, be patient. There's a program called Al-Anon. So if you do have a friend or family member that is an addict, you can talk to Al-Anon. That just reinforces the same thing that I just mentioned, which is you can't change them, but you got to figure out how do you take care of yourself, and then how do you support those people as well, right? But you have to make sure that there's boundaries that you create and that you're not just giving in or enabling it. I remember one client that I worked with, this was way back in my internship, that she ended up actually dying from alcohol poisoning. But her husband was the one, because when she was going through withdrawal, he couldn't witness essentially how bad she was doing. So he would be the one to go and buy her the booze, right? So of course, after she passed away, now he's full of guilt and shame because essentially he bought the booze that killed his wife. So you have to set boundaries. You can't enable the patterns. You have to be comfortable with what you do without regrets in the end. And that's essentially in your job itself, not just in addictions, just knowing that you've done everything that you can, kind of like I said in one of the previous seminars, but just knowing that you've done everything that you possibly can. You don't always have the answers. And hindsight, of course, being 2020, it's easy to know what you should have done after the fact. You don't always know during. So try that 10-10-10 and play it out and kind of see, is this going to get me to where I hope I could be? And would I tell someone else to do that same thing in my shoes? Yeah. So addictions, sorry, my slides aren't advancing. So here we go. So for yourselves, when you're dealing with challenges, dealing with stresses, just note self-care in a healthy way. And like I said, healthy versus unhealthy self-care. That's what you want to take into consideration. Unhealthy coping mechanisms are the ones when you project it long-term, it does not benefit, it does not aid your life. It might provide you in your own lens short-term gratification. So you have a drink, it helps you to sleep, but it's actually not restorative sleep. You smoked a joint, you feel like it helped you to relax or sleep, but you're not dealing with the issues. Again, you're just masking the issues. So we want to deal with these things. Now, with that said, some of the healthy coping mechanisms are also not going to deal with the issues, but at least it's not going to create additional issues like addiction, right? So by focusing on getting good sleep, good nutrition, maintaining an active kind of lifestyle, doing meditations, relaxations, these are not going to deal with the problems either. We still need to deal with those things, but at least none of these things are going to create more problems for my life, right? I'm not turning to binge eating to deal with my stresses so that I put on 20 pounds. I'm not stressing about sleep all night because I have a racing mind. So I end up drinking and then create a dependency on alcohol before bed because I can't sleep without a drink, right? So you want to make sure that you're using healthy coping mechanisms. This is where creating rituals to transition from work to home comes into play. So do you go for a walk after you kind of have your shift? Do you engage with the family depending on the time frames? Do you end up doing something that's fun or enjoyable, a meditation, relaxation exercise, right? Like what do you do that can be a positive to kind of segue from that work environment, which can be met with many traumatic events, into a different framework or a different state of mind with the family, with the home, with wherever you're going to be at, right? So it could be, again, just after work as well, talking about the positive things, celebrating successes, so engaging. Again, it doesn't have to be over drinks. It can just be get a pizza or something like that, right? Mourning losses as a group as well. So noting, again, bringing it up, talking about it. Now, this is where that stigma comes in, because for many individuals, if you get together, it's like, yeah, get over it, deal with it, don't bring it up, don't talk about it. It's actually impacting that entire group. And often what you'll notice is if you do bring it up, you'll start to notice those that are engaged and you can create that good support network with versus those that really don't want to be a part of it. And you don't force others to open up either because they have to take care of their own mental health. But at least you can kind of recognize, okay, well, who can I be open and comfortable with to bring these things up, to celebrate the good and kind of mourn the challenges that we've dealt with, right? So on an individual level, taking time to reflect, to journal, to look back at kind of what's gone on. So start your own little journal, get your thoughts out, just get it out of your mind so that you're not sitting there all night with these things racing through your head, especially the coulda, woulda, shouldas of what you could have done different. But just noting that, you know what, you did the best that you could have without regrets, knowing what you knew in the moment that you had it, right? Schedule positive things. So looking forward to the future is a huge component to help minimize depressions, anxiety, stresses, because you always have something to look forward to. So on the weekend, on the evenings, and next month, the next vacation, like always have something positive because that always keeps us going as well. But even looking at those positives, having those positives associated with the work environment, getting together with other workers, kind of doing something fun with them. So it's not always stressful or traumatic kind of based either, right? And then communicating, open up with the friends and family that you're comfortable with. And same thing as when you're doing that with the work colleagues, just noting who's kind of open to it and who's not. Some people are better at dealing with some of the challenges that you bring up, some aren't. So you're going to notice potentially for yourselves, I work with a lot of first responders, whether that's paramedics, firefighters, police officers, military, a little separate, but there's a different sense of humor that can come into that. So if you have a darker, more satirical, more sarcastic sense of humor, well, that might not necessarily resonate with a spouse or a different friend, but it could in that environment. So make sure that you know kind of who you're communicating with and communicate with them based on kind of what's comfortable in those environments, but open up to those that are comfortable in your environment, because even those outside of the work environment, it can help normalize and neutralize some of those stresses as well. But self-care is huge to keep your battery life full, to make sure that there's always gas in your tank. Because if you're running on fumes or your battery is drained and you don't have anything left, it makes it a lot harder for you to do the work that you do, knowing there's going to be more challenges. Like it's not typically you're called out to something where there's this positive event. It's typically critical incidents, just like people come into my office to talk about stresses, challenges, obstacles, not to tell me how amazing your life is, right? So set yourself up and be prepared for those things rather than assuming that the next day everything's going to go flawlessly, because that's not the nature of the work that you do, right? So just recognizing again, addiction is a mental health disorder. It is not a coping mechanism, of course, that I want you to use. So put yourself on that continuum. How is it impacting your life? Is it impacting it negatively, work, friend, family, social, personal, not comparing and contrasting to anyone else, but looking for yourself, how is this impacting my life? And if it's having that negative impact, then know what your resources are. Talking with friends, family, support groups, HR, EFAPs, counselors, programs, whatever it is, there's no shortage of programs that are out there and support that's available to you. But you got to take that initiative and take that care of yourself, because again, 10 years from now, we want you in a good place. I don't want you 10 years from now reflecting on how I wish I did something sooner. Right? So with that, thanks again for listening to me in this one. Potentially you'll hear me talk in some of the other ones. There are additional resources, of course, available. So support lines, websites, wellnesstogether.ca that you can check out. And as always, your EFAP, the 1-800 number and the website. So if you do want to talk to someone more direct about some of the things that you might be going through or what you're experiencing, or just to get some more knowledge or insight in those areas, either for yourself or even just reflecting on someone else in your life, then again, reach out, talk to the resources, right? So thanks again, everybody, for listening to me today. If you have questions, reach out to the programs. Otherwise, maybe I'll see you in one of the other workshops. Take care.